Welcome back to the Science of CBD. I'm your host, Antoine Schneider, and I'm joined today by a very special guest, Dr. Junella Chin. Welcome, Doctor.
Thank you. Thanks for having me, Antoine.
A pleasure. For over a decade, Dr. Chin has lived and practiced medicine in California, a state with legalized medical cannabis since 1996. In California, her integrative clinic focused on children with intractable epilepsy, cancer, and autism. She's seen firsthand just how much medical cannabis and CBD can benefit patients. Today, Dr. Chin practices in New York, where she treats both children and adults likewise, and she dedicates her medical career to finding effective, integrative, and holistic approaches to patient care. She's a frequent keynote speaker in the science and medicine of cannabis and CBD and has spoken at hospitals, conferences, and events all over the world. So one of the factors that really intrigued us to reach out to you, Doctor, was your personal story. It's quite a personal and powerful story, and we wanted to help share that with the world. So if you wouldn't mind, share that with our viewers a little bit.
Sure, absolutely. So my story is I was a patient before I became a physician. At 15 years old, I was diagnosed with ankylosing spondylitis, or AS. It's essentially an autoinflammatory disease of the spine. So what happens is it's a chronic pain issue. Your vertebrae start to fuse together, sort of like a bamboo stick, right? They start to crazy glue together. They become incredibly stiff, the different bones in my spine. And in my younger years, I tried everything. I did your conventional treatments of physical therapy, anti-inflammatory medications, muscle relaxants, epidurals. I did narcotics. I did alternative medicine, and I tried changing my diet. I did acupuncture. I did have natural supplements and herbs, but really, I got very little relief. At the end of the day, the pain was just unrelenting. And by the time I got to medical school, so I went to medical school in San Francisco, I had a really hard time standing. I would wear this big back brace whenever I was working in the hospitals or if I had to stand for any long periods of time or doing rounds. And one of my attendings, one of my mentors, Dr. Levine, had asked me about it because he'd see me wearing this back brace and pulling it as tight as I could just to get some stability. I explained to him about my condition, and I told him I couldn't take medication, any prescription medication I couldn't take because it made me drowsy, and I couldn't take it while studying. I couldn't take it while being in the hospital. And I expressed how sad and just really disappointed I was because here I was, surrounded by physicians, by great medical minds, but no one could really help my chronic condition. And I couldn't find any answers as a med student. So he pulled me aside and he handed me this tincture. And he didn't call it CBD oil at the time, but he mentioned that it came from the cannabis plant, but that it doesn't make you high. He said it's a different type of cannabis plant. So this is, of course, over 20 years ago. So we didn't call it CBD, but he just said this is a different strain. It really helps my HIV and AIDS patients. He explained it helps his chronic pain patients without making them feel euphoric at all or altered. I remember because it smelled strange. It smelled very earthy, like a cross between wet grass and dog. And I tried it. I reluctantly tried it. For me, growing up in the Bronx in New York City, cannabis or anything related to, weed, marijuana, really conjured up images of high school dropouts. It conjured up images of, an unsuccessful person, right? I had this huge stigma around cannabis, and I was a pre-med, so I had my eye on the prize. I had this linear path, and here I was in medical school. I was really shocked that a physician would offer me some sort of a cannabis plant tincture. But I knew that I had no choice, and he reassured me. He said, do it on the weekend, put it under your tongue, and let me know how you feel in a few days. And by Monday morning, I knew it was working. I just felt less stiff. I still had pain, but I felt less stiff. I was a little bit more mobile. And I decided after that point that I really had to learn about plant-based medicine. Really had to understand what was in this compound. Why did it work so well for me when nothing else had worked? And frankly, when you're in pain for so long, you're willing to try something else, right? I didn't want to jeopardize my career, but I also didn't want this to be my legacy.
Correct. Yeah. That's interesting that you bring up the point about 20 years ago, how we didn't know what CBD was. And there was kind of a stigma behind people that actually smoked marijuana. And you as a medical patient, or excuse me, a medical student, kind of trying to break that stigma when you realize that it works for you, right?
Right, right.
So I think that today that's one of the things that challenges somebody like you and I who work here in this field with CBD, and for you, especially with medical marijuana, is breaking that stigma. So I wanted to ask you, what can you tell us about today's industry, about CBD, medical marijuana? What about the stigma do you think that we need? How do we tackle that challenge?
Um, I think it's changed a lot over the years. I think we're really at a tipping point here, especially with passage of the Farm Bill, which legalizes CBD, which legalizes CBD derived from hemp. And with technology being able to help us pull apart the molecules of the cannabis plant or breed medicinal hemp for the CBD molecules for the plant-based medicine of using CBD so that patients can safely take it without feeling sedated or altered, really opens the doors for both the medical community, for the health and wellness in the preventative community as well.
Very true. Let's suppose that marijuana becomes legal tomorrow nationally. What are some of the trade-offs? So what might lead somebody to take marijuana over CBD and vice versa? What are the trade-offs between the two?
Well, really, it depends on what your symptoms are and what your goals are, what you're looking for. The two main players of the cannabis plant is CBD and THC, right? Those are the two main players. In hemp plant, it's mostly CBD. You have very little THC, little to nothing, less than 0.3%. So the CBD is a great anti-inflammatory, anti-muscle spasm, anti-pain. It's also an anticonvulsant, right? So it actually protects the brain and it brings down seizures. Now, THC also does those things, but it's much more relaxing and sedating. And if taken in higher amounts, it can produce a little bit of a mind-altering effect, which may be what you need if you are a cancer patient or if you are looking for something for insomnia. If you need something that has a little bit of THC in it, then that's when you would see a physician, a medical cannabis physician, and talk about that. If CBD is what you're looking for as a preventative or trying to use something that does not have psychotropic effects, then you could look at hemp-based products. Then you could look at things like that.
All right, Dr. Chin, thank you so much for joining us on the science of CBD. If you learned something or just enjoyed the video, make sure you hit like and subscribe. For more information about CBD or other phytocannabinoids, sign up for our newsletter and visit www.twinlabcbd.com. Also, be sure to check out Dr. Chin's educational platform, medicalcannabismentor.com. It's currently being used in dispensaries, medical schools, and hospitals in Canada, US, and Europe. She's also coming out with a book this June through Penguin Random House, and it's titled Cannabis and CBD for Health and Wellness. Once again, I'm your host, Antoine Schneider. Thanks for joining us, and we'll see you next time.
Thank you.